Let's talk about explant surgery and the differences in recovery if you're removing an implant that is under the muscle or over. So when you're removing implants under and over the muscle, the big thing that is going to affect your recovery is the muscle itself. So if the implant is under the muscle, we repair the muscle. And anytime you do muscle surgery, it just adds more pain and discomfort afterwards, and it makes the recovery a bit worse. I will say though, in my practice with nerve blocks and the ARIS protocols, I don't see a big difference between my patients in recovery, but certainly as someone who's had surgery with both under and over, under certainly is more tender. Now let's talk about capsulectomies and how capsulectomies affect your recovery. So there was a study that showed that, it was the Cosmetisure study, so there's this type of insurance, it's not really health insurance, it's this special insurance your plastic surgeon can purchase which helps patients cover complications from cosmetic procedures because sometimes they're not covered by regular health insurance. And so they looked in the database of patients that had implant removals with or without capsulectomies, and they found that if you have a capsulectomy, it doubles your major complication rate. So just at a baseline, you have double the major complications. They're still low, but they're double. And then just in general, adding a capsulectomy to your surgery is going to increase your risk of hematoma, seroma, and potentially hurting things you don't mean to hurt because it's a more extensive surgery. And some surgeons will use a drain for capsulectomies. I don't, but if they use a drain, that makes your recovery a bit annoying as well. Let's talk about en-bloc capsulectomy. So this is my soapbox. I'm going to go climb on it. So no one should be having an en-bloc capsulectomy with implant removal unless you have BIA ALCL or BIA SCC. It just shouldn't be happening. So an en-bloc capsulectomy is when you take the implant, the capsule, and a rim of normal tissue. There is zero indication for that other than if you have one of those capsule cancers. So those are so rare, no one should be having it. Now, there are some charlatans that are doing this, telling women with systemic symptoms from their breast implants that they're more likely to get better if the implants are removed in this way. But this has actually been studied, and there's multiple studies in multiple countries that show that no, removing the capsule does not help, and there's zero evidence that removing the capsule in that way makes sense. So unless you have severe contracture or ruptured silicone implant, there's really not a good indication to remove the capsule at all, certainly not in that manner. So if you have the capsule removed in that manner, your recovery is worse for a few reasons. Your incision has to be much larger. So instead of a cute little incision like this, you're going to have a much larger incision because of how the capsulectomy is done. The other thing is you potentially have more complications, more deformity in your breast. And I don't like it because there's no indication for it, and I don't think women should be put at risk and harmed for no reason. So the typical recovery for my patients, whether or not I take a capsule out, is that for the first week or so, people usually feel pretty good. Most of my patients don't take their opioid medicines. I do blocks, Journavx, Motrin, and they're comfortable and fine. At 1 week, I usually release people to go back to work. Most of my patients are able to drive by that point. Over the next couple weeks, I restrict your activity. I do want you behaving yourself while everything heals, so just normal functioning in life, but no heavy exercise till 1 month. And then after 1 month, you can do whatever the heck you want. That's the same whether or not you're under or over. If you're under, you may have pain for a bit longer. And when you start your activity back, it's a little more challenging for the first couple weeks, but otherwise the recovery is similar. So that's just a brief review of recovery from explants. Let me know if you have any more questions. And don't let someone talk you into an en-bloc capsulectomy, please.